En el vídeo de hoy vamos a hablar sobre inglés sanitario, inglés de la salud, inglés para profesionales del mundo de la salud, seas enfermero, médico, cirujano, psiquiatra, todas las personas que trabajáis en este sector y que sentís falta de confianza, un poco de inseguridad a la hora de requerido el inglés o queréis viajar a otro país extranjero y buscáis una oportunidad laboral más allá de lo que es el trabajo que hacéis en español. Vale, si es así, en el vídeo de hoy te voy a dar algunos tips para que empieces a ganar más seguridad, más confianza y para que empieces a entrenarte en esta habilidad de inglés para profesionales de la salud. Imagínate que tienes una entrevista de trabajo dentro de poco o que estás pensando en trabajar en el extranjero. Entonces, el inglés es un requisito importante para ti para mejorar. Muchos de vosotros, si eres enfermera, si eres médico, trabajas en este sector, sé que en las universidades no se enfoca mucho, no se da mucho en lo que es el entrenamiento en esta habilidad a la hora de comunicarte en inglés, en este sector en el que además las habilidades de comunicación son clave, porque estás en una situación muchas veces de estrés. A nivel emocional hay una gestión emocional muy importante, son conversaciones complicadas, cuando tienes que hacerlas con pacientes, cuando tienes que hacerlas con los familiares de los pacientes y cómo hacer esto en tu segundo idioma, que puede ser un elemento que añada más estrés todavía. Vale, en este caso lo que te quiero son dar algunos tips, algunos consejos para ayudarte a gestionar esto y a que cada vez te sea más sencillo, que tengas más confianza en tu habilidad como comunicador. Vale, lo primero, como te comentaba, y es algo que los coaches de comunicación hacemos sobre todo, es centrarnos en la dimensión más psicológica, es decir, en toda la parte que tiene que ver con cómo te relacionas contigo y cómo gestionas tus emociones y cómo eso impacta en cómo estás comunicando y en cómo te está percibiendo tu audiencia. En entender qué áreas de la comunicación te van a ayudar a sentir más confianza. En el caso de un segundo idioma está por un lado la parte de ganar fluidez, pero el hecho de hablar de una forma que notes que estás tranquilo, que no te sientas juzgado por los demás, que no sientas que es un añadido de estrés. Luego está el elemento de pronunciación, de empezar a entender los sonidos del inglés, el aspecto muy característico del connected speech que hay en el inglés. Entonces son diferentes dimensiones dentro de esta habilidad. Ahora bien, el caso del vocabulario, por ejemplo, de ir adquiriendo vocabulario, es una parte muy importante en una habilidad de un segundo idioma. Sin embargo, se ha dado muchísima importancia a solo el vocabulario y es una parte más de la habilidad, pero no lo es todo, es una parte más de esta habilidad, porque sí que es verdad que cuanto más vocabulario vas adquiriendo, vas a articular tus ideas de mejor manera, te va a ser más fluido también, más fluidez. Es lo que es la fluidez. La fluidez tiene que ver con la adquisición de más vocabulario, de más expresiones. Ahora bien, quiero que tengas súper claro que por el hecho de tener más vocabulario no significa que vayas a tener más confianza. La confianza, digamos, que tiene más que ver con la gestión emocional, con tu relación contigo mismo. Entonces, cuando trabajas esa confianza para comunicar, afecta en otras áreas de tu vida. Bien, cuando se trata de adquirir vocabulario, sí que es cierto que eso puede impactar, influir en tu confianza, vas a sentirte mucho más hábil a la hora de articular cosas y más cuando se trata de algo muy específico. Por eso esto se llama inglés técnico, cuando es algo más específico. Digamos que todos los profesionales tienen como su cultura profesional y su vocabulario muy específico, y así ocurre en el caso del inglés. A mí como coach de Business English, inglés profesional, me pasa mucho que a veces como si fuera una actriz, porque tengo como que ponerme en el papel de muchos profesionales diferentes y sumergirme en la cultura de sus profesiones y entender mejor cómo funcionan y el jargon específico de su profesión, porque muchas veces esa parte que es más técnica, en el vocabulario que es un poco más técnico, hace que tengas que empaparte o sumergirte de una forma más intensiva en ese tema. Y por esa razón, en el vídeo de hoy te quiero explicar cómo puedes hacerlo en el caso, por ejemplo, del inglés sanitario, del inglés. We're going to talk about this immersion topic. As you know, what I always recommend my clients and everyone, it's like creating this kind of immersion bubble. I kind of do it more in the American culture, so there is also aspects of culture. For example, if we're talking about healthcare, in America, it's a very different healthcare system. It's like a private healthcare. Whereas here in Spain, we have a public healthcare system. You're gonna notice those differences when you're watching series, movies, reading books about the topic. So for today, it's just a little introduction, and I'm gonna give you some recommendations. And what I like to do is create this kind of digital immersion using things that are easy to find, accessible, that are entertaining, that have good quality, and that are adapted for you at an intermediate level. So if you have to prepare for, you have a job interview in a few days, or in a couple of weeks you have a job interview, the idea of creating an immersion around the topic could be a great thing, because it's going to help you find more confidence in how you express yourself. Remember that with job interviews, it's all about telling your story as a professional, feeling like the way of telling your story. And sometimes it's very purposeful, the training on communication, because it's also about those specific words, vocabulary, improving the clarity around pronouncing those words. So I really recommend you using, in this case, things that are very easy, accessible for you, like series, like movies, magazines, podcasts, and books on the topic of healthcare English for doctors or nurses, all around the topic. With the first series I'm going to recommend you, I go back to the 90s with ER, emergencies. Series because of George Clooney, because this is the series that made George Clooney very famous, very popular.
So anyway, she says to me, I didn't know that pediatricians could be so sexy. And I said, honey, you ain't seen nothing yet.
Famous, very popular. And this is a series about the relationship between doctors and nurses in this ER work, en una sala en la unidad de emergencias. It's very common that in many of these kind of series, the thing happens in ER because there is more thrill and it's more action. So for dramatic purposes, it's completely normal that many series are based on these ER words.
I'm going to bed. Wake me at 6:30.
Mark!
What is it?
Can I give Mrs. Williston more Demerol? She's complaining of pain.
50 milligrams, I am.
Thanks, Mark.
Like in the case of emergencies. It's very common that many of these series are set on these kind of emergency wards. In the case of ER, it was in Chicago, so it's a hospital in Chicago, and you can notice a lot of different scenes, so it's very easy for you to find a little clip from the series and use it as a way to practice certain jargon that it's very common in your field. Like, for example, where a doctor is making a diagnosis. Notice the pronunciation of this word, very different. In Spanish, diagnóstico, diagnosis, tiene vocales del inglés americano. Recuerda que en inglés americano las vocales, a diferencia de en el español, que las hacemos pronunciándolas con fuerza, con más tensión desde la boca, en el inglés americano nos vamos a la garganta y se produce el sonido como más relajado. It's very important that you start to notice those differences when you are training yourself, when you are imitating the pronunciation of the words. And there are some of these words in medical English that are especially challenging for us. The case of diagnosis is one of that. So in ER, there are many scenes where you can practice with the word diagnosis. There are many others where you can see medical procedures or surgical interventions. So surgical, cirugía, surgeon, cirujano. So there are many surgeon scenes with the surgeon.
No. If I paralyze him, I don't get to Craig, then he dies. Okay, Drake. Can someone please hand me a stereo, Drake? Is that the membrane? Horizontal or vertical?
Horizontal. No. Vertical skin incision first, then cut horizontally through the membrane. I'm sure.
Thyroid's got to be in there somewhere. Okay, horizontal. All right, give me the bullet. With a self-inflicted GSW to the mouth, he said 4 units, BP 70 over a 50. Pulse is 54. Tried to intubate him, but there was too much blood and tissue, including his airway. I was just about to start a quick thyroid on him.
All right. Paralyze him?
No.
Good boy. All right. Skin hook. Come on. 6.0 trach tube. Let's move. Call radiology. Let him know he's on his way with a CT. Back. Come on, let's move. All right, let's pack it. Stop all this bleeding. So you were going to do the crank?
Yeah.
All right. Blake.
Yo.
Get head and neck out of bed. This is their lucky day.
Got it. Wrong choice?
Nope. All right, come on, people. Let's go. Let's get them up. Move.
Call them, tell them we're on our way. Yep, they know. Go on and head to traffic.
Last day, right? All right, don't forget to turn in your lab coat and your ID. You get your deposit back.
Also, the exposure. Northern Exposure is also a series that takes us back to the 90s. And this is a series that was set in a fictional little small town in Alaska. So you can also enjoy the beautiful landscapes of Alaska in this series. It has a very peculiar type of dialogue because the characters are very eccentric. And it's based in the story of this doctor that very unexpectedly ends up having this kind of medical practice in this town. So he is a general practitioner. This means es medicina general, it's general practitioner. So with this, it's great if you are somebody that works as a general practitioner or in primary care, because a lot of conversations that have to do with talking with patients, like talking about the different symptoms. It is a pronunciation, this is a challenging word for us, symptoms, and where you can also notice the ways of conversation with that.
Ed, let me ask you something. What does belonging to your own tribe mean to you?
Bingo.
Bingo? You mean like bingo? That's it?
Well, I was raised by the tribe, but since I didn't have parents, I was passed around a lot.
Never really thought about it. I mean, belonging to a tribe. I belong to the Jewish tribe, so to speak, but I'm also an American, you know? But what does that mean? I mean, if they're an American tribe, it's more like a zillion special interest groups. In my own case, I am a New Yorker, I am a Republican, a Knicks fan. Maybe we've outgrown tribes, you know? It's the global village thing. It's telephones, faxes, CNN. I mean, basically, we all belong to the same tribe.
That's true, but you can't hang out with 5 billion people.
That's a good point.
Different one that is more modern, we have New Amsterdam. So in New Amsterdam, we have this the main character is always asking, how can I help? How can I help? So it's actually very fun way. Like the character, it's unbelievable. Like you don't believe there is anybody like this in the world. He's very, very always thinking about how he can help people. And it's a series that I like the fact that it's not only doctors and nurses, but you also have a psychiatrist. There is also an oncologist. So it's like you go through different areas of healthcare. And I also appreciate the way that you can understand better the healthcare system in America, because they talk a lot about budgeting. They talk a lot about how the hospital finances the research in different areas, how they kind of manage that, because the main character is also managing a little bit, is in the management aspect of the hospital. So it's interesting. That's a new thing that is more unlikely in other series on medical English.
With so little help. So I'm going to hire you 50 new attendings, because untrained residents will no longer be running this hospital, regardless of how much money their university makes off their indentured servitude, or how much time it affords some of you to play golf. So, let me ask again. How can I help? Yeah. Person not calling their lawyer.
Lauren Bloom, emergency department. I want to get rid of our waiting room.
Okay, where do you want to put it?
I want to get rid of it. I want to move patients direct to bed, no waiting room.
Done.
Really?
Sure, let's try. Yeah.
Hi, Dr. Iggy Fromm, head of psych. can we do something about healthy food?
What do you want to do about it?
Have some. Chewy, in the hospital.
Okay. Done.
Aces. Thank you.
Thank you. You know, we all feel like the system is too big to change, but guess what? We are the system. And we need to change. So just tell me what you need, what your patients need, and I don't care if it's not covered, I don't care if the board said no. Let's get into some trouble. Let's be doctors. Again. Okay.
Okay, so now going a little bit into English for nurses more specifically. So if you're a nurse, I want to give you also ideas for you to immerse yourself on English for nurses. So in this case, my recommendation, it's a series in Netflix that is brand new.
There's a shock of the rhythm. Charging. All clear. Defibrillation.
Cardiac arrest.
Start chest compressions. Adrenaline.
So is she on any meds we should be aware of?
Does anyone know anything about the patient?
Yeah, this is Alma. She's 59. She was admitted with respiratory difficulties. She had irregular heart rate, atrial fibrillation, and now ventricular fibrillation. SAT of 69. Pulse can't be measured. Blood pressure 60/20, and respiratory rate close to 0.
Anything else to take into consideration?
Yeah, we've had her on oxygen while she's been here, and there's nothing cardiological.
Thanks, Christina. Well done.
Time for rhythm check.
There's a shock of the rhythm. Continue chest compression. Charging. Clear. Defibrillation.
She's breathing. We've got a sinus rhythm. What about ECG?
Yes, we need an ECG. Thank you, Christina.
Remaining stable. Oh, there she is. She'll be training you. Christina, this is Pernilla. She's new on Ward 3. Hi, Pernilla. Welcome to emergency. Thanks.
And it's a series about, it's based on a true story, and it's set in Denmark. So you can like change, turn the audio into English because the original is in Danish. But this is also great for us because it's easier for intermediate levels to understand a series when we change the audio to English, when it's not the original version, it's not English-speaking countries. So it's actually great. And the series The Nurse, you have different episodes, and it really takes you through the way nurses work at a hospital. And the story, it's a little bit upsetting because it's about a nurse that it's kind of a serial killer, okay? Like she kills patients. There is, because of how great it describes how a nurse works. And you can find a lot of terminology and jargon from English for nurses, like, for example, IVs or like blood clots or blood tests, also cardiac arrest. There is the movie The Good Nurse. So The Good Nurse, it's a very similar storyline with Jessica Chastain and Eddie Redcliffe. And I really like the way the actors are playing in this movie. It's also based in a true story.
Hey there, lovebirds. Look what I brought. Is that the best thing you have ever tasted?
How are the girls?
They're really good.
I have 2 girls, 4 and 7.
Mine are 5 and 9.
Ms. Martinez, expired. Don't ask, I don't know what happened.
Anna died. Detectives, we've come across something troubling.
Do you recall anything odd about what happened to her?
Work's been pretty awful.
We understand that you work with a Charlie Cullen.
Yeah.
Could he be involved in this?
I don't want to talk about Parkfield.
Why not? There was a rumor about him. Is it because what they're saying is true?
We need your help, Amy.
How well do you know him?
Really well.
Maybe he's not who you think.
I want to talk about Parkfield.
Doing with with any of these series that I just recommend you is to find little clips where the jargon, the vocabulary that you find especially interesting for you appear. Select those clips and use them in a technique of shadowing. That means you imitate the characters, you imitate the actors, and also you record yourself and you notice how they are pronouncing, you compare with the way you pronounce, check out the phonetics of those words. Great way to start to practice at home these skills of communication, okay? So that's kind of my interest for today. If you have a job interview, if you're interested to improve your vocabulary for healthcare, for anything related with working in this field, this will be a great thing for you to start doing at home, creating this kind of immersion bubble, more specific, more intentionally on your topic. And remember that when we talk about confidence as a communicator, that's another dimension of the skill that has much more to do with psychology and has much more to do with the way you relate with yourself and how that manifests in your communication. So many times we think, because I have all these words and I have all this vocabulary, now I'm going to be confident, but it doesn't really work that way. Vocabulary and getting all these expressions can really help you, and it's a part of that, building that confidence. But the confidence piece, it really goes with the way you relate with yourself, the way you give yourself grace and compassion whenever you make mistakes, whenever you're not getting something in the way that you think that you should. So it's kind of a different dimension of the skill. Communication coaches, we really try to help you with the part of mindset, like going through different things. Communication, as everything in life, it's a manifestation of other things that going on through you, and like the way you relate with yourself. So there are different things that we can work and help you get where you want with your communication skills and like objectives regarding that. So there is so much you can do at home, so much you can start to practice and train yourself to get better at communication. And if you're a healthcare professional, I'm sure going through any of these series can be a great way to start getting more in touch with what you need to work in English at a hospital or any place where you need this specific vocabulary.